Good morning. Today we'll be revising the ascending tracts. So what is a tract? It is a collection of nerve fibers within the central nervous system which connects two masses of gray matter. So other terms which are similarly used for tracts, fasciculus, for example fasciculus gracilis and cuneatus, and lemnisci, ribbon-like tracts, medial lemniscus and lateral lemniscus. So what is the common thing for these tracts? They have similar origin, course and termination. So they are named after gray masses connected by them. For example, spinothalamic tract. So here this tract is extending from spinal cord to thalamus. So it is a sensory tract which is also called ascending tract. So then corticospinal tract connecting cerebral cortex to the spinal cord. It is a motor tract and also called descending tract. You can see here in this particular half. So there are so many descending tracts. So named after the gray masses which they are connecting. You can see. So this descending tract always starts with the name of the higher center. Like if you see, it is corticospinal tract. And what is this lateral? Lateral is the location of the particular tract in which funiculus of the white matter of the spinal cord. As you see, it is in the lateral funiculus of the spinal cord. That's why it is a lateral corticospinal tract. Same corticospinal tract which are uncrossed, you can see in the anterior funiculus. So this is called as anterior corticospinal tract. And these are the ascending tracts which we are going to study here. So we have three different systems. So these are dorsal column pathway, otherwise called medial lemniscus pathway or posterior column pathway, so which is having fasciculus gracilis and fasciculus cuneatus. So fasciculus gracilis also called as tract of Gall, and fasciculus cuneatus also called as tract of Burdock. So these carry the conscious proprioception, and here we have spinocerebellar pathway, anterior and posterior spinocerebellar tracts, so which has unconscious proprioceptive fibers. So here there are lateral spinothalamic tract and anterior spinothalamic tract, so which carry pain, temperature sensation, lateral spinothalamic tract, touch, especially the crude touch, tickle, pressure, all these sensations by anterior spinothalamic tract. So coming to different modalities, so there are three different modalities like exteroception, stimulus from external environment, proprioception like position, then interoception, stimulus from internal environment. So these are the three basic modalities we are going to feel senses. So then if you see the sensory pathway versus motor pathway, so in sensory pathway minimum there are three order of neurons, first order, second order and third order. As you can see here, the first order neuron is from peripheral receptor to spinal cord, location is in the dorsal root ganglia. Second order from spinal cord to thalamus, located in spinal cord or brainstem. So third order from thalamus to the higher center, located in thalamus. So number of neurons for motor pathway will be two, one upper motor neuron and one lower motor neuron. So upper motor neuron is from higher center to spinal cord, whereas lower motor neuron is from spinal cord to effector. So there is an exception for the sensory pathway where there are only two order neurons, that is for unconscious proprioception, none other than the spinocerebellar tracts. So posterior column pathway, otherwise called as medial lemniscus pathway. So it is having fasciculus gracilis and fasciculus cuneatus. So these two fasciculi are separated by posterior intermediate septum. So first order neurons. So these actually the fasciculus gracilis and fasciculus cuneatus, both these tracts are actually the central process of first order neurons from dorsal root ganglia. So fasciculus gracilis starts from sacral, lumbar and lower 6 thoracic segments, whereas fasciculus cuneatus is bit higher in origin. So it is seen from upper 6 thoracic vertebrae level and also from cervical levels. So then if you come back, you can clearly see that here there is no crossing over. As you can see, they have to ascend on the same side, so they are not crossing. But when you compare the same thing with the spinothalamic tracts, so definitely spinothalamic tracts are crossing, but here they are not crossing. This is only with respect to the spinal cord level. So if I say fasciculus gracilis and fasciculus cuneatus, they are not crossing at the level of spinal cord, whereas spinothalamic tracts are crossing at the level of spinal cord. So then you can see here now the second order neurons, nucleus gracilis and nucleus cuneatus, these are located in the medulla oblongata. So once the first order neurons come and relay at this level, so from this point start the second order neurons. So these are called as internal arcade fibers. They cross to the opposite side and ascends upwards as the medial lemniscus. So they will be reaching up to the level of thalamus, ventral posterolateral nucleus of thalamus. Then the third order neurons are the ventral posterolateral nucleus of thalamus. So from the afferents from this nucleus will project to the sensory area of the cerebral cortex. So as you can see, the functions of this dorsal column pathway are the fine touch, in which we are going to differentiate the tactile localization and 2-point discrimination. So these are the two important special functions of this dorsal column pathway. In addition to that, as I already said, it is the conscious proprioception. So it is having these three basic components like vibration, joint position, and muscle proprioception. So here you can see this is the first order neuron which is located in the dorsal root ganglia. So these are the peripheral process, this is the central process. See here, the first order neuron itself is ascending as the fasciculus gracilis and fasciculus cuneatus. It is going up to the level of medulla oblongata. So this is the nucleus gracilis and this is nucleus cuneatus. So there is a relay, and the second order neurons are coming as the internal arcade fibers. So this is the level of sensory decussation. So this internal arcade fibers will cross to opposite side and ascend up as the medial lemniscus. So they are going to terminate in the thalamus, and third order neurons from the thalamus will reach the sensory cortex. So clinical implication, so there is a sensory neuron disease which affects the posterior columns. So usually the cause is hereditary sensory neuropathy or tertiary syphilis. Functional deficit is loss of all the functions of the dorsal column pathway, like loss of fine touch, joint position, vibrations, and loss of 2-point discrimination. But crude touch is still intact because it is carried by the spinothalamic tracts. And spinothalamic tracts, there are two spinothalamic tracts, namely lateral and anterior, both together also called as anterolateral tracts. So, but for discussion, we are continuing with the lateral spinothalamic tract, where the first order neuron is the dorsal root ganglia, whereas second order neuron is located in the spinal gray matter, especially the posterior horn. So, these second order neurons immediately cross to opposite side, ascend in the lateral white column as the lateral spinothalamic tract. Third order neuron is the ventral posterolateral nucleus of the thalamus. Efferents from this nucleus will pass to somatosensory cortex. Functions are pain and temperature. So you can see here, this is the lateral spinothalamic tract. See the difference here. So this is the dorsal column pathway. So this is the first order neuron which is ascending here, and there is no crossing. Whereas if you see the spinothalamic tract, so this is the first order neuron which is ending here, the second order neuron immediately crossing to the opposite side and forming the lateral spinothalamic tract. So anterior spinothalamic tract, again first order neuron is the dorsal root ganglia, second order neuron is the spinal gray matter. So these ascend for 1 to 2 segments and cross to opposite side. Whereas in lateral spinothalamic tract, they are crossing immediately at the same segment, but here they are ascending 1 to 2 segments up, then cross to the opposite side and continues as the anterior spinothalamic tract. The third order neuron is in the ventral posterolateral nucleus of thalamus. Efferents from this nucleus will pass to somatic sensory cortex. Functions will be crude touch, pressure, tickle, and itch. Lateral spinothalamic tract, pain and temperature, whereas anterior spinothalamic tract, crude touch, pressure, tickle, and itch. You can see this is the anterior spinothalamic tract, this is the lateral spinothalamic tract, this is the dorsal column pathway. So we are left out with these two important things, the posterior spinocerebellar and anterior spinocerebellar. So before going to the spinocerebellar, so there is a simple clinical application here. So when there is pain which is very severe, which is not relieved by any kind of analgesics, so there are two surgical procedures which are rarely done. This is the first one is a cordotomy, where lateral spinothalamic tracts are cut to relieve the pain, or posterior rhizotomy, in which there is cutting of posterior nerve roots to relieve the pain. So these two, when we are doing this procedure, always the knife should be posterior to the ligamentum denticulatum, because anterior to ligamentum denticulatum will be the ventral root, posterior to the ligamentum denticulatum will be the dorsal root, which is sensory in nature. Spinocerebellar tracts, anterior spinocerebellar tract. So this is the first order neuron. So again, it is the same thing. It is located in the dorsal root ganglia, whereas second order neuron is the posterior gray column of the spinal cord. So for anterior spinocerebellar tract, the location starts from lumbar and sacral segments. And see, there are only two order of neurons. There is no third order of neuron for spinocerebellar tracts. So these fibers, see the speciality. They actually first cross to opposite side, then ascend as anterior spinocerebellar tract. After reaching the level of pons, they will cross to the same side of origin and enters the same side cerebellum through superior cerebellar peduncle. So if it is anterior spinocerebellar tract, it is entering same side cerebellum through superior cerebellar peduncle, but it is crossing to opposite side, then coming back to the same side. The functions will be unconscious proprioception from lower limb as a whole. So entire lower limb as a whole, unconscious proprioception from entire lower limb. So you can see here, this is the anterior or ventral spinocerebellar tract. This is the first order neuron. So it is terminating here. This is the second order neuron, which is crossing to the opposite side and ascending after crossing the pons. It is coming back to the same side. Then it is entering the cerebellum through the superior cerebellar peduncle. Same thing if you see the dorsal spinocerebellar, which is the posterior spinocerebellar tract. You see this is the first order neuron, which is entering to spinal cord and terminating. And the second order neuron is ascending on the same side as the dorsal spinocerebellar tract or posterior spinocerebellar tract. Then it enters into the same side cerebellum through inferior cerebellar peduncle. Remember this difference. Superior cerebellar peduncle for ventral spinocerebellar, inferior cerebellar peduncle for dorsal spinocerebellar, and ventral spinocerebellar is crossing and coming back, whereas dorsal spinocerebellar is ascending on the same side. But ultimately both have to come to the same side cerebellum. So to revise, so first order neuron for posterior spinocerebellar tract is the dorsal root ganglion. Again, second order is the same, posterior gray column of the spinal cord, but these fibers ascend uncrossed in the lateral white column. So passes through inferior cerebellar peduncle to reach the cerebellum of the same side. Functions unconscious proprioception from individual muscles of the lower limb. So earlier it was unconscious proprioception from entire lower limb, whereas here it is unconscious proprioception from individual muscles of the lower limb. For upper limb, the counterpart for this posterior spinocerebellar tract is the cuneo-cerebellar tract. So other ascending tracts, spino-olivary tract, name itself speaks, spinal cord to inferior olivary nucleus, concerned with proprioceptive information. Spinotectal tract, tectum is concerned with the vision. So spinal cord to the tectum of midbrain. So reflex movement of eyes and head. Then spinoreticular tract. So where this tract connects the spinal cord to the reticular formation of brainstem and it influences the level of consciousness. Thank you.